Welcome to Elevate Care. I'm your host, Kerry Perez, and we have a really amazing guest here today. I'm so excited to talk with Chris Keithley, DNP, RN, NEABC, who's serving as Vice President, Patient Care Services, and Associate Chief Nursing Officer at Bay Health. Chris, welcome to the show.
Oh, thanks for having me. I'm excited to be here too.
Awesome. Great to have you. So let's talk a little bit about your bio. I might kind of cheat a little bit and read right from here because it is really accomplished. I want to make sure that I hit the highlights. So a decade of progressive leadership experience. And I love this. Propelled by her strong desire to foster excellence in nursing practice at Bay Health, she works alongside nurses to create efficiencies using best practice and data to deliver a standard of high quality care for patients. She thrives on seeing how the impact of collaboration improves patient outcome. In her role, she collaborates with the chief nursing officer to nurture evidence-based clinical nursing practice across the health system. Also know that prior to Bay Health, you served at a 4-hospital system responsible for operational oversight of nursing, centralized staffing, nursing supervisors, remote central cardiac monitoring, virtual patient monitoring, nursing float pools, EMS transportation, and system transfer center. Wow.
Yeah.
That is impressive. Chris, anything else you'd like to add about your bio or maybe anything in specific to your role at Bay Health?
So my role at Bay Health is new. I started there 10 months ago, moved from Pennsylvania to Delaware. I'm enjoying it very much. I really am invested in the nursing workforce. That's probably one of my passions is making sure that nurses have what they need, the tools they need to do their job well and be there for their patients. If we don't take care of the nurses, they can't take care of their patients, right, either.
Oh, that's a great soundbite already.
Yeah.
Thanks, Chris. And I also understand you serve on a board.
I do. Well, I am the executive sponsor of the Nursing Workforce Council, which is very near and dear to my heart. We have staff nurses, some of our nurse managers. We all work together, really tackling issues and problems that come up with staffing, scheduling, recruiting, and retention. And it's my desire to have as many bedside nurses as we can work together because we want to make Bay Health the best place to work in Delaware. So we've done a lot of great things. We've moved from every other weekend to every third weekend, trying to work on, some work-life balances. We've had, brought in some flexible scheduling, just really, and they have great ideas, Yeah. So I think the closer you are to the work, the more ideas you have and the better they are, the better they'll serve.
And so no better than to be on this podcast to talk about the topics that I'll give a brief overview of. So how technology is shaping patient care, fostering collaboration for improved care, addressing staffing challenges and burnout, near and dear to our heart, building partnerships that can drive innovation in healthcare, importance of data-driven decisions, and of course, some advice for aspiring healthcare leaders. Really excited about those topics. So let's jump in.
Okay.
Let's start with technology. That's on everybody's lips. From your perspective, how do you see technology influencing patient care in the coming years?
So I think the big thing is AI coming through. One of the things that I'm really excited is ambient voice for nurse charting, which I think is going to be a game changer for the bedside nurse. They spend a lot of time, charting in the EHR, and they'd really rather spend their time educating their patients, doing discharge planning, making sure they understand what medications they're taking. So it's going to give them the opportunity to have more time directly with their patients.
I think that's so important. As we've talked about AI a lot, even in personal life, you think you want AI to take away the mundane stuff so you could focus on the stuff that matters. Artists don't necessarily want AI creating art. They want them to do all the things that allow them to do more art. So that's great. That can be applied on the nursing spectrum as well. Okay, so when people have more time, hopefully they also have more time, to collaborate. Talk about fostering collaboration among your team to improve patient outcomes.
Yeah, so our team is really engaged. We have a team of CNSs, clinical nurse specialists, and our staff nurses. And one of the recent projects they worked on, we noticed that our pressure injury rates were going up in the hospital. So this really big team of staff nurses, our educators, our CNSs, some of our nurse managers all got together and came up with a whole new plan. They made changes to the electronic health record and how, they're charting. They had a bundle that came out. They talked about, how do I know if I'm using the right bandages on this patient or the right, lotion or whatever it might be. So They looked at all of the pieces that were causing these additional pressure injuries to happen, and I think they have a great plan coming in the future, and we're starting to see it decrease now again already.
Oh, that's awesome.
Yeah.
So what are maybe some of those things that you think enabled that collaboration?
I think really it is that every nurse wants to do the best thing for their patient that they can. And it's hard when you're a nurse and something happens to your patient or they have an injury, it hurts. They feel that. And it's really, the drive to have good outcomes.
Okay, so let's talk a little bit about staffing challenges. We know that retention is such a huge topic, especially as it relates to staffing challenges and staffing shortages. From your perspective, what strategies have you implemented to address those challenges and promote retention?
So we've done quite a few things. We had 3 staffing summits where we brought a whole group of people together and we talked about what are our safe scheduling guidelines, what is our weekend commitment, who's getting pulled from the unit first if someone has to, float out, what's the hierarchy of cancellations if, somebody wants to volunteer if you're overstaffed or something that hasn't happened in a long time. Just looking at those pieces and making sure that we're fair and equitable across the system. We looked at we had a vacancy rate, and when we had a sign-on bonus, and the sign-on bonus was kind of out there for everybody. But when we looked at the data really closely, we realized there was 2 pockets of vacancy on 2 units. So we had to be specific about where are we going to place our energy to make sure that those units are getting first dibs and getting looked at, and that we're, making sure that the staff there have enough people to work with every day. There's a lot of other things we're doing. We have a partnership with the University of Delaware. It's called Clinical Nurse Scholar. So we met with the 2 teams, with Bay Health and University of Delaware, and we came up with this plan where their students will come to Bay Health and they'll do their clinical rotations. They'll complete them there for the last year of their senior year during school, and then they'll sign on to work on one of our floors. So they get to know us ahead of time. They get to know what they're expecting, and we get to know them. So it starts the partnership while they're still in school. They gain that trust with their nurse manager, with their peers, the people they'll be working with. So it just gives them a comfort level before they get here.
You mentioned data in your explanation, and we were talking a little bit before this that we both kind of love data-driven things. Tell a little bit more about, how you go about looking at that data and the sort of analysis that you might have uncovered something you didn't think that you would see.
I use the data I got from the AMN dashboard to do my DNP project, and I did that on using a workforce dashboard to help nurse managers decrease floating, because if you know anything about nurses, they want to work on their unit when they come to work. And when they get floated out, it just doesn't go well. So we used that data and looked at where were when was it happening the most? Where were we short-staffed and why was that happening? And then we also looked at how many patients do we have, what time of the day, every day of the week, because it fluctuates. But some days you might have more surgery, so your census is a little higher to make sure you're staffed more. The ED gets crowded on Monday evening and Tuesday morning, so that's when we need more staff. So looking at all of those points and staffing according, so we have the right amount of nurses to meet patient demand.
So we just were speaking also about, retention. I loved the sort of partnership with the university to get people in. How do you then handle, challenges of maybe more seasoned nurses as well who are facing that sort of work-life balance and potential burnout?
Yeah, and that is an issue. And really making opportunities for those nurses to work part-time if they wish to. We are bringing up a virtual nurse platform. So that would be a great opportunity for someone who wants to stay in the clinical role, but maybe not at the same level they're at now. It's less physically demanding. And in that role, they can really work as a mentor and kind of, help the younger nurse or the new to practice nurse along, answer questions for them because they're in a virtual platform, but they still have availability for that.
Okay, on that virtual platform, definitely hear that a lot of people and hospitals are interested in getting a virtual platform going or a virtual model, but not everybody has been able to sort of embark in it. Was that hard to get implemented or to get approved?
We did not have trouble getting it approved. I think we recognize that with staffing shortages as they are, having higher vacancy rates, turnover, it looks different after the pandemic than it did before. I think, not all staff are staying in the same place. Some like to travel. Some want to try different things. There's a lot of nurses who want to be, advanced practice or nurse practitioners. So we need to give them the opportunity to do that. And the virtual platform is something that supplements your staffing, and it takes the burden away from the bedside nurse. Like we talked about doing some of the things that you don't need to be at the bedside to do, like an admission profile or medication reconciliation or patient education. They can do all of those things virtually.
And are you having people volunteer and opt in to do that? Are you seeing, any different groups kind of gravitate towards it more than others?
So we actually haven't launched yet, but we are starting with a pilot. So we'll have 2 units that are going to pilot and work through the kinks a little bit before we get started, going live across the system. So 2 med-surg units we're going to pilot, and we're really going to focus on the admission profile first and trying to get the workflows right for that virtual nurse.
That's great. Well, keep us posted, because I'm sure we would also have tons of nurses who would be interested in that.
Yeah.
You hear a lot of surveys that are going on, and people aren't necessarily wanting those 12-hour shifts anymore.
Yeah.
And they're wanting to do a lot more gig work. So I think it's really great that you're kind of already piloting and answering some of those needs of our nurses.
Yeah.
Yeah.
One of the things we did when we were, just to get ready for it and making sure that we are benefiting the nurse, is we sent out a survey and surveyed the nurse. What do you think? What do you want? So I think that will be helpful in adoption.
Yeah, that's great. Anything else on burnout before we move into a next question?
I think it's kind of mirroring the behavior, making sure that I'm not working till 7 p.m. every night, or I try not to notify or call my staff when it's their day off. And especially the staffing office, I feel, we don't want to be calling nurses every single day when they have a day off and making them feel like they have to come to work. Right. They should be able to have that time to themselves. Mm-hmm. And we need to respect that.
Oh, that's important, I feel like, in any industry.
Yeah.
Yeah. I guess lastly on that, post-COVID, are you seeing any different sort of preferences or, I don't mean to say demands, but I guess desires from clinicians in the workforce?
I would say we see they really are interested in professional development, and we're looking ahead at their career and maybe not staying at the bedside their entire career. They want to have options, I feel, and there's more generations working together now. So, that can be challenging, but it also can be empowering, for us to learn from each other.
Okay, excellent. All right, going back maybe a little bit to data perhaps, but you were so gracious to talk about, using a dashboard from AMN to help you with some analysis of your staffing. Would be interested also to understand, how's your collaboration with AMN maybe elevated the quality of care at Bay Health?
So we meet with AMN weekly. One of the things that I really like about the partnership is that I know they're going to follow up and they're going to follow through, and we didn't sign the contract and then it ended. If I have an issue, I can call. I have resources that are there to me, and there's consistency. It seems that the team members here at AMN have a lot of longevity. I see the same people all the time. I feel like there's a relationship, that we know each other. It just helps us feel comfortable and feel like we have the same goals and that we're working for the same things.
Yeah. Yeah, our mission is to empower the future of care. And, at the end of the day, it's all about the patient. And so I guess as far as, AMN or maybe any other partnerships that you have, what value do you think that they're bringing to patient care services in particular?
So I think forming partnerships is a great way. Like we have the partnership with the University of Delaware, we have a partnership with AMN. It's really shared vision, shared goals, and having the same mission, to do right by your community and right by your patients.
Yeah. And, when I think of partnerships too, it's, yes, they're always there when you call, but are there examples where you are working together to solve a problem?
I would say for sure. The reason we were looking for, a new partner was because our needs weren't being met. And when COVID hit, we had more and more of our travelers coming on board, and we were doing all the credentialing, and that was falling on my staffing coordinator. And before you knew it, she had 125 nurses that needed to be credentialed, and we weren't getting support from the company we were working with. So when we switched to AMN, we had those conversations and talked about it during implementation that we need help with this. And now there's a repository that AMN keeps for us. And then if something happens or the Joint Commission comes in, I can call and say, I need these documents, and they're right there. Or I can just go get them, actually.
Oh,
yeah,
great.
myself.
Thank you. Not to be self-serving. We appreciate that. And we really value our partnership with you as well and with Bay Health. And I know that we have worked with you also previously at another organization.
Yeah.
So thank you for, that longstanding relationship. If there's anything also to touch on technologies or any innovative solutions, you're mentioning credentialing, but anything else with partnerships, AMN or otherwise, and about how technology has started to play a role in that value?
Yeah, I think we're looking at quality measures all the time, focusing on what is our monthly quality measures, our goals for our, workforce. What are they? What are they for nursing? We all need data, and we need to make sure we have that for, to meet those goals. Some of the things that I look at is our turnover, our net gain. Are we bringing in more nurses than are leaving every month? And getting that information to our nurse managers so they know what's happening on their units and they can make the right decisions when it comes to hiring staff. It's been really helpful and a game changer.
Love that. And again, a little bit off script, not to put you on spot, but do you maybe have any examples of where a decision might have been made one way, but then through, data or technology was like, oh, actually, we need to make a different decision?
Yeah, well, I think we talked about our vacancy being in those two pockets. That was a really good recommendation there. But I think it's really ongoing. And some of the quality metrics that we look at, we can implement things ahead of time. If our fall rate is going up or we're seeing patients fall with injury go up, we can make changes. And we can make sure, or we can just say, were we following what we needed to follow? Did we cross, all our T's and dot all our I's at the time? So we can look back at that and make sure that we are doing those things so that it doesn't happen again or that we can turn it around.
Excellent. Thank you. Okay, shifting gears a little bit, you've had such great success and tenure. What advice would you give to aspiring healthcare leaders?
I think a lot of it's about relationships and support and really respecting those that work for you and the work that they do. And making sure that it's really what you want, because it's not easy. Being a nurse in general, it's not an easy job. It's at times it's emotional and it can be physical, and just make sure you're authentic about where you want to be.
Yeah. So if you had to maybe describe some characteristics that, great healthcare leaders have or that they should aspire to have, what would some of those be?
So we just did an exercise yesterday. We had a retreat and talked about this. Well, empathy, of course. For me, I think I like to be lighthearted. I think the work we do is heavy all the time, so you have to make time to smile and have fun and get to know each other. You have to be a confidant, and you have to have integrity. Yeah,
those are great. And I've often heard too that getting people into the nursing profession is different than it has been before. Needing to kind of educate more people that it actually is a great profession to go into. Going back to maybe the relationship with University of Delaware, is there a different way in which we are speaking to potential new nurses to get them excited about the field? There
is, and we have a nurse residency program. And I think that's really supportive of the new nurse. Their two coordinators of that program are fantastic. They go to University of Delaware. They have conversations with the nursing staff. They meet with the high school students, which really is important. You need to get to people before they hit college, really. Yeah. So middle school, high school, we have to get in there and say, health careers, think about it. It's a great profession, and you're doing a great service to your community.
Okay, and this is a question that you can usually open or end with, but always like to hear, your why. What is your why for getting into healthcare or being in healthcare?
So my why really now is support of nursing in general, supporting the nurse at the bedside, the nurse manager, making sure they have the tools to do their job. But it all comes down to why you're in the profession. That's because you want to care about your patients and you want to care for your community. Is there anything that you're willing to share that kind of tugs at your heartstrings when you think back to a great moment that made you feel like, yes, I made the right decision? Well, there's a lot of things. I mean, there's a lot of contact that you have with patients and their families and building relationships, and kind of it comes back, you'll see them again, or you might see someone in the supermarket and they say, "You were my nurse," and I remember what happened, and thank you for being there for me. So that always makes you feel like you're in the right place.
Yes. Well, thank you for everything that you do. And thank you also for being on Elevate Care. Great conversation, Chris. And thank you for the partnership with Bay Health. Before we close up, is there anything that we didn't talk about that you'd like to mention?
I'm just looking forward to the future of nursing and seeing, great things happen.
Same here. Chris, thank you so much. And everybody, thank you for joining us.
Thanks for having me.
Yes, thank you. Thanks for joining us on Elevate Care. We will see you next time. Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.